This is a great question, and other people have asked me this as well. Yes, we do have medications that can dry up the secretions, but the side effect is that it also dries out the mouth. So when you have somebody that's not taking a lot of fluids already, and they're breathing usually with their mouth open, which is really drying, the medication just makes it so much worse. And unfortunately, there are situations where sometimes you feel like you're medicating the family by giving medication to the patient. And I really hate that so much. To me, it's very unethical. And so I really do a lot of education around how to treat the secretions without medication. And that is just lifting up the head of the bed, turning a person on their side, and keeping their mouth really clean.